Welcome back to Ebru Today. Dr. Mary Beth Morgan is a veterinarian here now to talk about how to keep your pets safe this summer. Welcome. Good to have you here. Let's first of all talk about some of the most common infectious diseases for our cats and dogs.
Yes. Mainly for dogs, we are concerned about heartworm disease, Lyme disease, and then also Giardia, which can also affect cats.
Giardia is something I've not heard of before. What is that?
It's an intestinal parasite. And I have definitely seen an increase in the occurrence of it. I think a lot of it has to do with the weather. Ever since Hurricane Irene came through in September, we had an extremely wet fall. We had a very mild winter, and then it's actually been a very wet spring. So it's an intestinal parasite that we can also get from wildlife. So contaminated water sources in addition to our pets.
Well, that's what I was curious about. How is it transmitted? Is it contagious?
It is, and it's something that we can get, which as a veterinarian, it's very important that I discuss.
Did you say we as humans can get?
Yes.
No, so not just transmitted dog to dog.
That's correct.
We can get. What about dog to cat?
Dog to cat, cat to dog, dog to people. So it's what we call a zoonotic disease. So it's very, very important, basic hygiene when you're handling or cleaning up feces. But it is fecal-oral transmission, so the little cysts are shed in the stool, and either handling the stool or if it's wildlife transmitted, they can defecate in water sources. So if your pets are drinking water sources, or if you go camping and you drink water source.
Well, there you're walking the dog in the neighborhood and there's a puddle of water, they drink it. What are the signs we need to look out for? Diarrhea
is the main sign. So what we call large bowel diarrhea, kind of increased frequency, urgency, straining. A lot of people will freak out when they see blood in their dog's stool. So diarrhea is the main thing. Sometimes we do see vomiting associated with it.
So how do you diagnose and then treat?
A stool sample. So we always tell our clients, anytime your pet has diarrhea and you schedule an appointment, it's always a good idea to bring a fecal sample along if you can get it. Sometimes it's hard to get. If not, then we will try to get it. And it's very treatable with medication.
All right. Now, is there any way to prevent some of these diseases? You mentioned things like Lyme, heartworm. There are pills, or excuse me, things that you can put, like Frontline. I shouldn't endorse one product, but things that you can put on your pet to prevent them. But what about these other?
For Lyme disease specifically, there are topical medications, what we call flea and tick preventatives. There is also Lyme vaccines. So years ago, technology for vaccines, they weren't as good as they are now. So we definitely advocate those dogs that have exposure to it. Believe it or not, we really don't see Lyme disease in cats. No real documented cases. Heartworm disease, as you said, medication, once a month medication, that's very easy to get. Right now, we are running into an issue of availability. Interceptor, a very common medication, has been on national back order since January. So most of our patients are opting to use something like Iverheart, HeartGuard, Trifexis, even a topical one called Revolution.
I have to imagine that dehydration has got to be a real issue in the summer.
Yes, yes.
So let's talk about the importance of making sure you just keep the bowls watered.
Yes, especially if you have pets that spend a lot of time outside. They need access to fresh, clean water. We can't make enough of a point about leaving your pets in a car. I mean, it's kind of common sense. If you sit in your car and you have the windows up and it's locked, you sit in there for a minute or so, it's amazing how fast the temperature rises. So heat stroke is a very serious life-threatening issue. And I think one of my pet peeves is how people handle heat stroke. I've been to charity events in the summertime, and their first inclination is to throw a wet towel over the pet. And unfortunately, that actually traps the heat in.
Really? Okay.
They also have that inclination to use cold water. They grab the cold water out of the cooler. And believe it or not, just using regular, I'm not going to say room temperature for outside, but regular ambient temperature water just helps to liberate the heat from the body, because pets don't sweat like we do. They don't have sweat glands.
As a veterinarian, final thoughts here. You see people coming into the animal ER with their pets. What's the most common preventable mistake that you can leave our audience with advice?
I would say this time of the year with people traveling with their pets is making sure that they keep them safe, that they're not getting hit by cars, they're not getting into fights with other animals. So making sure they have a means of identification, whether it's a collar with a tag, a microchip. We've learned the value of microchips after Katrina, locating a lot of pets with their owners. And just common sense. If you're uncomfortable outside, it's really hot, I don't think you want to walk on hot black pavement. It's obviously going to hurt their feet. So common sense goes a long way.
Dr. Morgan, we thank you for your insight and analysis and advice as well.
Thank you.